You received this kit from the Wellness Hub research team to collect blood using the dried blood spot method, or DBS, at home. You should not do the DBS test if you have a clotting condition such as hemophilia or von Willebrand disease. In addition, you should not complete the DBS test if you have experienced fainting or vomiting due to a finger prick or the sight of blood. Please note that if at any point you feel that your health or safety is at risk due to this test, please stop the test immediately. It is recommended that you administer the test with someone nearby in case you begin to feel unwell. Prior to completing your DBS collection, you should have completed your Wellness Hub online consent form and demographic questionnaire, and received a participant ID number from a member of the Wellness Hub research study team. If you have not completed these steps, please contact the team at wellnesshub@unityhealth.to. The blood sample will be used to determine whether you have antibodies to COVID-19. After you have finished collecting blood, you will need to send the DBS to the Wellness Hub research team at St. Michael's Hospital. If you consented to receiving the results of your antibody tests, these results will be delivered to you through your preferred method of contact. You will see that the kit contains a detailed instruction sheet, one dehumidifying pack, one dried blood spot or DBS card, one humidity indicator card, one small envelope, 2 single-use purple lancets, 2 alcohol swabs, 2 gauze pads, 2 bandages, 1 plastic bag with a label to write your participant ID on, and 1 prepaid postage envelope. Make sure you are seated comfortably at a clean table with all provided materials. Start by writing your participant ID and the date of collection on the dried blood spot card, as well as on the label on the front of the small orange envelope. Wash your hands with soap and water or use hand sanitizer. Fold back the flap of your DBS card to uncover the testing area with the 5 circles. Make sure to not touch this area. Your card should look like this. Do not touch the filter paper in the middle of the card. You may only touch the side of the card. Choose which finger you will be using to collect your sample. Only use your middle or ring fingers. Open the gauze package and set aside. You will need this gauze later. Twist off the protected cap of the lancet. Use the alcohol swab to clean the entire tip of the chosen finger all the way down to the first knuckle and allow it to air dry. Position the lancet on your fingertip. The needle should go across the fingerprint lines, not in the same direction. Lay the back of your hand against a solid surface and push the tip of the lancet firmly and quickly into your finger. You'll hear a click and feel it prick your finger. Once a lancet is used, it retracts back into the device and cannot be activated a second time. 2 lancets have been provided in the event that you are unable to complete the test with only 1 finger prick. Should you choose to do a second finger prick, make sure to use a different finger. Let a small drop of blood form at your fingertip and wipe it away with a gauze pad. Do not use the alcohol pad to wipe away the blood. Let the blood drop in the middle of the first circle of the blood spot card without touching the blood spot card with the punctured finger. Now it's time to start collecting the blood on the card. Gently squeeze your finger from the base towards the tip to help a blood drop form. Once a large drop of blood forms on your fingertip, let the blood fall from your finger onto the card. The blood should saturate the card and show through the other side. Do not let your finger touch the card. Fill at least 2 circles with blood using the same method. Moving on to the next, the goal is to fill all 5 circles, but fewer full circles are better than more incomplete circles. If one drop of blood is not enough to fill a circle, aim the next drop of blood beside the first drop until the circle is filled. Avoid layering blood drops directly on top of another. The picture below demonstrates a good dried blood spot sample compared to a poor quality sample. However, antibodies can be measured even from 1 or 2 spots and from partial spots. If you have attempted the DBS test, you should mail back your DBS card no matter the outcome. Even if you were only able to fill 1 circle, or if none of your circles are complete, the laboratory will still try to analyze your sample. What should you do in the case the blood from the side of your finger is insufficient? Puncture another finger with another lancet. Before you puncture another finger, you could increase your blood flow by letting the arm of the finger you have selected for the finger puncture hang down at your side for about 30 seconds. Safely dispose of the lancet and the other materials you used for sample collection, such as the gauze and the alcohol wipe. After collection, apply the gauze pad to the finger that you punctured for the DBS test until bleeding has stopped. Once the bleeding has stopped, apply a bandage to the punctured area of your finger. Place the DBS card in a safe place until it is completely dry. Drying will take about 3 or more hours. Do not place it in direct sunlight or near a heater, and keep it out of reach of children and pets to avoid contamination. Once dry, fold the flap back over the blood spots and place the DBS card into the small orange envelope. Write your participant ID and date on the label of the small orange envelope. Place the envelope, the humidity indicator card, and the dehumidifying pack inside the plastic bag. Remove as much air from the bag as you can before closing it. Put the resealable plastic bag into the mailing envelope. Place the plastic bag into the prepaid, pre-addressed envelope and seal it. Write your postal code in the 6 boxes in the bottom right-hand corner of the return label. Do not write your name or address on the return label. Drop your completed envelope off at either the designated area at your long-term care or retirement home or at the nearest mailbox.